Arthritis literally means joint inflammation. It is a disease that causes damage in the joints. Joints are places in the body where two bones meet, such as the elbow or knee. Some joints naturally wear down as one ages. Lots of people develop arthritis after that normal lifelong wear and tear. Some types of arthritis happen after injuries that damage the joints. Certain health conditions also cause arthritis. There are many different types of arthritis with different causes and treatments. In some types, other organs such as the eyes, the heart, or skin can also be affected. Arthritis can affect any joints, but it is most common in people's hands and wrists, knees, hips, feet and ankles, shoulders and lower back, also known as the lumbar spine. There are more than 100 different types of arthritis. How many do you know about? Stay tuned for more as we discuss all you need to know about arthritis on your regular Hair TV talk show, The Physicians. It's another day with the Physicians, where your health is our business and will always be our business. My name is Dr. Martina Agwere, your regular anchor on this program. And with me in the studio is Dr. Mebuna Yusuf Kadiri. Yes, I had to introduce her so that you would not disrupt me. We'll be discussing all you need to know about arthritis. Dr. May.
Thank you very much, Dr. Martina. Of course, to all our viewers, it's always a good time to be here because, you know, on your favorite Hair TV talk show, The Physicians, your health is our business and will always be our business.
Yes, Dr. May, when you talk about the old bones, the elderly people always sort of start to shake. Now we're talking about arthritis, all you need to know about arthritis. But is arthritis actually a disease of the elderly alone?
No, it's a myth which we need to bust. And we need to let people know that. Because, you know, when somebody in their 20s, 30s have issues when it comes to their joints, they always believe that it's not arthritis. Their first rule is it could be something else, not really looking at arthritis because they believe that it's for the elderly. We do know that with age, yeah, you are more prone, you are more at risk, but that myth, I'm happy we have a guest who is going to break it down, because you've just said in your introduction we have over 100 different types. So if you know about the common one, you may not know about the uncommon ones. And
is it only the disease of the bones alone?
No. Those are the things that's why the Physicians is a great platform to educate the general public.
Okay. I'm very, very excited that we have a guest that will handle this particular topic. All you need to know about arthritis. We'll be back after this short break. Stay tuned and don't stay alone. Call one person, a friend, a family member to watch with you. Thank you. Welcome back. If you have just joined us here on your regular Hair TV talk show, The Physicians, where your health is our business. Today we'll be discussing all you need to know about arthritis. And in the studio with me is no other person than our very, very able Dr. Hakeem Olaosebikan. He is a consultant rheumatologist. We don't have many of them in Nigeria, not talk of in Lagos. He's also a senior lecturer at the Lagos State University College of Medicine. Dr. Hakeem, you're welcome to our program.
Yeah, thank you for having me.
You're welcome,
I'm glad to be part of you today.
I'm really, really excited that you were able to make it today. So we're talking about all you need to know about arthritis. And maybe you want to give us a general overview on what you're talking about arthritis. Let's a general overview before you talk about the main causes of arthritis.
Yeah, thank you again. And thank you for creating this laudable platform to create awareness, because arthritis is just simply mean swollen joints, which can be painful or not painful sometimes. And then, as rightly said in your introduction, that it is a lot of myths about arthritis that we need to dispel. Arthritis is not just a disease of elderly. It can happen, it can occur in any age group. It is not just more common in women, it can be seen in men as well. And then arthritis is not just one disease, it is a manifestation of more than 100 diseases. And sometimes it's beyond the joint you are seeing. Sometimes what is happening in arthritis can be going on in other parts of the body. And that is why when you are evaluating arthritis as a doctor, it should be an holistic evaluation to ensure that we comprehensively find out the cause of arthritis. Because arthritis is not just one disease. You need to look for the cause. We may be 10 people in this room, we all have arthritis. What we cause will vary from person to person.
Okay.
So it is not one disease. So the role of a rheumatologist is to identify the underlying cause of arthritis and treat according to cause.
So it's actually the swelling of the around
Swollen
the joint.
joints, around the joints.
So now you're talking about us knowing the causes, the reason, because we have more than 100.
Sure.
More than, and so we need to know what is the underlying pathology, what is responsible, or the risk factors.
Yes, thank you so much. Now, arthritis, as I said, swollen joints, which can be painful or not painful. There are several causes of arthritis. And so we divide the causes into two. The modifiable causes and non-modifiable causes.
Okay.
When we say modifiable, we mean that those causes that can be modified through behavioral changes or lifestyle changes. Okay. And non-modifiable means that those ones that cannot be modified. Okay. So let's talk about the non-modifiable causes. Or those causes can also be regarded as risk factors. The certain things that increase the risk of developing diseases. Okay. Now, one of it is age. There is a certain arthritis that increases as we grow older. And that is called osteoarthritis, or what's called wearing and tearing arthritis, which is common in elderly. Okay. But that is the most common arthritis all over the world. However, that is mostly restricted to the elderly age group. But young people can also have osteoarthritis as well through different mechanisms, which I'm going to talk about later. That is one, age. Second is gender. Women are more likely to develop some arthritis than men. However, some arthritis are also more common in men than women. Okay. The third one is ethnicity or race. Black, they are more likely to develop arthritis than the Caucasians. Just like hypertension are more common, is more common in black than the Caucasians. Some diseases are also more common among Caucasians than black as well. Okay. So then if you have family history of arthritis, that one may not be modifiable. Maybe your mom, your dad, you may also develop arthritis. Doesn't mean that it is 100% certainty. Then the other aspect is maybe you have a genetic susceptibility to develop arthritis yourself. Okay. Maybe there is some genes or proteins that increase the risk of developing diseases. So you may have developed that gene sometimes where we inherited it from our parents sometimes. And the parents may not even have the disease. The gene is recessive in them. They cannot manifest the disease. But when they transfer it to us by giving birth to us, we may have tendency to develop some arthritis as well.
Okay. Do you have anyone that is lifestyle?
Now,
lifestyle?
Let's talk about modifiable. Modifiable include lifestyle you talk about. Okay. Lifestyle with what we eat sometimes. So if you are involved in high intake of carb or high calorie food or refined food, it might trigger some arthritis, because inflammatory food can trigger inflammation we see in arthritis as well. For example, if you eat a lot of assorteds, these offals, organs, meat, intestine, kidney, liver, and even red meat can increase the risk of an arthritis we call gout, G-O-U-T.
Yeah, too much meat.
Yes, too much red meat. Or even you eat a lot of seafood, like crayfish, lobster, it can increase the risk of gout. Because gout is an arthritis due to uric acid accumulation in our body and in our joints.
So it means that we would likely see more of that one in the visuals, the rich people.
Sure,
red meats and
yes,
the seafood.
In the olden days, gout is more common among the kings, the rich people. But now we are seeing gout in younger people as well, in the less affluent people as well.
So maybe that's lifestyle.
That's your lifestyle. So if you don't drink alcohol, like excessive intake of alcohol can trigger gout. Okay. Also, if you don't drink alcohol, maybe you don't drink alcohol, you drink a lot of sweet all these fiber, all these juice,
Okay.
you know, all this
Sugary
food.
It can also trigger gout as well. So it's either way. A poor man will want to drink more sugar, while a rich man, okay, I can want to drink wine.
Yeah.
Both wine and sugar trigger gout.
Yeah.
Like somebody will tell you, I don't take alcohol, but I take red wine.
Yeah. So all of them trigger gout. So that is lifestyle. There's another risk factor is infection. If you have an acute infection that just recently happened, can trigger some acute arthritis. Acute means it just happened. And some infection can also trigger arthritis later. It might not just be at the time you're having that infection. It can like COVID-19 can sometimes trigger some joint pain and joint discomfort later after surviving COVID. We call that post-COVID syndrome. And some other infections too that you have acquired in the past can also trigger some arthritis as well. Like there's an infection called Neisseria gonorrhea, which people call gonorrhea. It can cause arthritis in men, and unfortunately also in women as well. So there are some sexually transmitted infections that can cause arthritis, that can trigger arthritis.
It's a whole lot.
Yeah. So tuberculosis that affect the lungs can also affect the joints. You can have a tuberculosis inducing arthritis as well. That is. Then the other thing is immune-mediated arthritis. When our immune system, just wake up one day to start fighting our joints. So a patient there's a disease called rheumatoid arthritis, which is due to our immune system fighting our joints. Or psoriatic arthritis, or even lupus that we discussed some time ago. Yeah. All these autoimmune diseases can also manifest with arthritis because the immune system attack joints as well as attacking other parts of the body. Then you can also have arthritis from medications. Some medication can trigger some rheumatism that can also cause arthritis later. For example, if you use quinolones, all these ciprotab that people just buy, self-medications, it can also damage the joints. It can damage the tendons and sometimes can also lead to arthritis. Then trauma, which people talk about, injury, which is, that one is a really poor view of orthopedics. But I'm talking of non-traumatic causes of arthritis that are not due to traumas or injury. So not only trauma or injury or aging are the only causes of arthritis. There are other several causes beyond being old, beyond trauma, or beyond having injury, but either domestic or road traffic accident, whatever, that can cause arthritis later because you have injured your joint and everything like that.
But we saw that it even affects the eyes and the hands.
Yes, it's like a multi-organ.
Some arthritis actually, they are multi-systemic disease. They are multi-organ disease. But they will present with arthritis at the initial presentations. And if the person, unknowingly, you do not see an expert, you'll be managed for that joint problem.
Exactly.
Whereas the cause is systemic. The cause is not actually in the joint, although it's manifesting in the joint. For example, a patient with a child with a disease called juvenile idiopathic arthritis. It's a form of arthritis we see in children due to their immune system affecting their joints. They may present with joint pain. But that joint problem is just a manifestation. The same JIA, that is arthritis, can also affect the eyes. You can have uveitis in the eyes. It can also cause blindness.
And that's why, at this point, it's good that you are breaking this thing down for us, because with this, we know that they are over different the types, and it's not about aging, it's not about trauma, and the fact that their manifestation, you may just think it's arthritis until you meet an expert that will tell you that, yes, this is a manifestation, but it's multi-systemic. Sure. It will be good for us to now know what are those signs and symptoms. Because we can't say everything, but at least what are those common ones that people should look out for. So that, I think because we strongly believe that prompt referral to experts like you will help better outcomes. So if that is something that you can share with our audience, the signs and symptoms.
Yeah, thank you so much. Now, the common arthritis is the osteoarthritis, also called wearing and tearing arthritis, or age-related arthritis of elderly. And that will usually affect the weight-bearing joints, such as the knees, the hips, or the waist, and the back. And because they are the weight-bearing joints. So that will affect the more commonly. Not that it can affect other joints. Those are the common joints that it can affect. Now, they have this joint pain when they are using their joints. Maybe they want to ambulate or walk around. But when they sit, the joint pain improves. But in advanced cases, they continue to have the pain whether they are at rest or they are active. And that one is associated with swollen joints. Okay. Sometimes the joint can be stiff and warm. And in advanced situation, it can lead to joint damage. But it rarely affects other parts of the body apart from the joints. They can have associated medical issues. They can be obese, they can be very far, they can be plus size person, they can be hypertensive, they can be diabetic. They may have other health issues because they are elderly and middle-aged, so they are prone to other medical comorbidities or medical issues. That is osteoarthritis. However, there are some other arthritis that a lot of doctors may not be able to identify if you are not an expert. You assume that arthritis is just osteo. And those ones are the ones we generally call inflammatory arthritis. What they mean is that they have their joint pain when the patient is not doing nothing. That is at rest. But when they try to be active, the pain is less. It's like an opposite of what happened in osteoarthritis. The pain is worse in the morning or at night. The joint pain is worse in the morning or at night. And then when they wake up or as the day progresses, the joint pain improves. However, in advanced situations, today also have the pain both at rest and with activity. And those ones affect small joints like the fingers, the wrist, the ankles, the toes, the small joint, the elbow. Although those ones can also affect the weight bearing joint, but commonly the small joints. And those are seen in younger people, young children, young adults to middle age. And those ones, common causes are the immune system problem, as I told you about that. Our immune system can go into overdrive and attack the joints. And it's starting from the joint. However, they can also have other symptoms beyond the joints. They can have skin symptoms. They can have red eye. They can have hair loss. They can have some lumps on their joints. Okay. You know, those ones are actually life-threatening or even more disabling compared to osteoarthritis because it's associated with other internal organs or other organs affectations. So what I tell my colleagues, doctor, is that once you see arthritis that is not that is not typical, that is affecting the weight bearing joints, not elderly, not associated with activity, it might be beyond osteoarthritis. Okay. Because any doctors can treat osteoarthritis, except it's advanced. You cannot refer to orthopedics. But ideally, the other arthritis cannot be treated by any doctor. It's better to identify them early because identifying arthritis early prevents joint damage and joint deformities. Because the problem of arthritis, if it's not diagnosed on time, patient can develop joint deformity and can limit their function. It can lead to even both physical and mental disability can happen because of the loss of self-esteem and everything like that, and it can affect their function and activity. So the aim of any evaluation of arthritis patient is to identify the cause, identify the root cause, and the root cause will now determine the specific treatment you want to give. Because painkillers are not the specific drug for arthritis. Yeah. Painkillers are just used to ameliorate the pain at that point. While you investigate and identify the root cause.
I think that, because that's where we want to get into now, because it's paramount that now we are talking about something that even we doctors are like, oh, whoa, this sounds common, but I might have maybe missed that diagnosis because, that intervention I referred, yes, high index of suspicion, referring to the expert, very key. So at this point, we would like you to educate us and our audience on how do we even make the diagnosis? What are those diagnostic criteria that will say, okay, this is it, this is the point I can treat, this is the point I need to refer appropriately to the expert.
Okay, thank you so much. Now, different arthritis, they have their diagnostic, we call it pills, or something that you can hold on.
Exactly.
For example, an elderly person or middle-aged person walks to my clinic complaining of pain on the knees or on the waist or the back, and it's associated with activity. It's likely to be osteoarthritis until proven otherwise. But you have to exclude trauma or injury. So that. Secondly, a young man or a middle-aged man come to my clinic with sudden onset of pain on the big toe. Swollen big toe, or swollen ankles, painful ankles or feet, or swollen knee, just sudden onset. And the person's and you ask question, patient said that I've just we just went for a beach party. I drank, or maybe New Year party, or I went to a party and I drank a lot of alcohol, or I ate a lot of pepper soup, seafood. All those things we point to when it's like to be a gout. Gouty arthritis due to uric acid accumulation in our joints. Now,
over time,
the problem of uric acid is that it's not just the joint; it can also accumulate in the kidneys and cause kidney stones. You can have uric acid stones in the kidneys and can cause kidney damage as well. So it is not just the joint problem. And uric acid is also a risk factor for cardiovascular disease, artery and heart issues. So it can actually also lead to sudden death. And that is why it's beyond the joint, as I talk about now. Now, another arthritis is the one that's called rheumatoid arthritis, common in young women. And that one is usually initially before the joints problem start, they have this unexplained fever. This unexplained weight loss, unexplained fatigue. And before they start having painful swollen fingers on both fingers now. Both fingers will be painful and swollen. The wrist may be, the knuckles will be swollen and painful. And it usually worse early in the morning when they wake up. They can't get out of bed because they have prolonged morning stiffness. Sometimes it takes them more than 30 minutes to get out of bed. And by the day it progresses, they feel so good. But in advanced situation, they can also have lumps on their joints. What is called nodules, lumps on their joints. Sometimes they have dryness of their mouth. Sometimes they have internal organs symptoms as well. But initially it's bilateral symmetrical swollen joints pain and stiffness that is on both fingers or both toes or both wrists, and with prolonged morning stiffness. They can have non-specific symptom of fever, they can lose weight, and they can develop fatigue. That's rheumatoid for you. The another arthritis is called septic arthritis. That one is usually due to infection. Sudden onset of swollen, painful, maybe the knees, that is very hot, Maybe the patient is treating some infection and maybe it is poorly treated. And now has an affected, and now his patient also moved to the joints. That one is usually an emergency because it can damage the joints quickly. So you need to ask about all that complaint of fever, or maybe the patient has diabetes, which can increase the risk of infection, or HIV/AIDS, or all these diseases that can weaken the immune system. So you need to accept that. Then there are other arthritis that are due to connective tissue disease like lupus and all those joint. Those ones we know that they have fever, weight loss, night sweats, sores in their mouths, sores in their throats, hair loss, skin irritations, and they also have joint problem with it as well. So when a doctor is evaluating arthritis, you must always ask about constitutional symptoms.
Constitutional.
Yes, non-specific symptoms that may indicate systemic problem. That means this arthritis you are seeing is beyond the joints. Are there history of recurring fever?
Unexplained.
History of progressive weight loss, progressive night sweats, or even fatigue, in addition with the joints symptoms. And when you see arthritis in an unusual joint, because people see that arthritis more in the knee and the fingers, or you see it in younger people, it is more likely to be all those immune-mediated arthritis compared to the osteoarthritis.
Dr. Olaosebikan, you have said a whole lot about the symptoms and that. So maybe everyone is listening and watching. You have talked about the different types of arthritis, the possible causes.
The risk factors.
Now the risk factors. Now they are beginning to align. Oh, this is where I belong. I think this is what I have. I think this is what we can present. Please, how is it managed? Let's talk about the solution.
Yes, it's better to talk about solution. Now, the best solution to the best way to manage arthritis is prevention. We do it because by the time arthritis symptoms develop, it's already advanced. Because that's so we don't want you to even develop arthritis. So some arthritis can actually be prevented, and some you might not be able to prevent it at the moment because of those that are non-modifiable. Like can't change the fact that I have a family history of something. I can't even I'm a female gender. You can't, but those ones that can be modified. For example, now if your arthritis is due to the fact that you drink a lot of alcohol, you eat a lot of seafood, to avoid those food, or if your arthritis is triggered by inflammatory diet or high carb or high calorie diet, to avoid them. So if your arthritis, if you are the type that you are prone to infection. Avoid infection as much as possible.
Yeah.
Avoid and treat infection appropriately. But if you don't treat infection well, the infection can later react and cause arthritis later.
Okay.
So there are so some arthritis. If your arthritis is due to being overweight, shed your weight. Yeah. Or if you have a family history of arthritis, ensure that you are also very careful and be proactive about it. So that is what I can talk about prevention. However, if they now have arthritis, what we used to tell patients is that the painkiller you are using is a temporary measure. Exactly. It is not a permanent treatment for arthritis. The treatment for arthritis is usually based on the cause, because they are, as we said, there are 100 diseases that can manifest with arthritis. A lot of them are different. So you need to ensure that a doctor needs to, if you don't know about arthritis, refer appropriately to teaching hospital, where they will see a rheumatologist that can investigate arthritis appropriately. So the treatment depends on the cause. When someone wants to do gout, we don't give, it's not painkiller per se. Painkiller is just to relieve symptoms. But there are specific medications that you can't use it for another arthritis. Exactly. And that is why you need one need to identify the cause of arthritis and treat based on the cause. So the painkiller has a lot of problems. And I want to educate the public. Okay, great. Painkiller has been associated with a long-term health issues. You may not have the problem now when you're using the painkillers, but it can trigger ulcers. Exactly. It can trigger heartburns. It can trigger reflux. It can damage the kidneys in the long term. It can damage the liver. And can also increase our risk of artery and heart diseases in the long term. So don't avoid, uses of painkillers. If you are using painkiller, don't use it for more than a week, and always seek to know the cause of your arthritis. Thank you.
Thank you very much, Dr. Olaosebikan. In fact, time is not always enough when you have to talk about these things that have to do with autoimmune So, but I really appreciate you for coming. I'm sure we have all been schooled, and our viewers out there have actually benefited. We really appreciate you, and we hope that we will have you again in our studio to discuss some other very important things that have to do with your specialty as a rheumatologist. And to our viewers out there, I just want to say thank you for keeping a date with us. You heard what Dr. Olaosebikan just said. Painkiller is not the solution. In fact, it even has its own health challenges and complications. Try as much as possible. The only simple word, visit your doctor. Let it be managed. My name remains Dr. Martina Agberi. Until next time, stay blessed.
Thank you very much, Dr. Olaosebikan. And to all our viewers, always a pleasure to be here, and of course, being part of our show. We deeply appreciate you. Please be kind enough to follow us on all our various social media platforms. And if you want to be a part of the show, you are just a click away. Go to our website, fill the form, and you'll be here. My name remains Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.